Hey, how's it going, everyone? This is FixerMed. Welcome back to my high-yield biochemistry review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 1B of a multi-part video series detailing and describing the entire discipline of biochemistry from start to finish in a comprehensive but high-yield manner. Today, this is a special part because this will expand upon Cell and Molecular Biology. Cell and Molecular Biology was a really big video, and I think we can do more questions to hammer at those concepts to give you guys a better understanding for these exams. So this is kind of like an optional video. If you want more questions, feel free to watch this. If not, just go ahead and click out. But without further ado, let's go ahead and get started on some questions. So we have a 35-year-old female that presents with a history of recurrent bronchitis and sinusitis throughout her life. She also has a history of ectopic pregnancy. Cardiac examination reveals the point of maximal impulse at the fourth intercostal space, right mid-clavicular line. A biopsy of a nasal polyp is taken. Which structure is most likely to be absent on electron microscopy of the biopsy specimen? I'm going to give you guys a few more seconds. Alright, moving on. If you need more time, feel free to pause the video. The presentation is consistent with primary ciliary dyskinesia, Cartaginer syndrome. Dynein arms are essential for the function of cilia, which normally line the respiratory tree's pseudostratified columnar epithelium. Absence or dysfunction of dynein arms leads to impaired ciliary movement, resulting in increased susceptibility to respiratory tract infections. Therefore, the correct answer is C, dynein arms. Let's go through and break down the incorrect answer choices. Actin filaments. Actin filaments are not the primary structural components of cilia. Their absence wouldn't characterize Cartaginer syndrome. Microtubules. While microtubules are part of the cilium structure, the specific dysfunction in Cartaginer syndrome involves dynein arms. Cilia. The absence of cilia or impaired ciliary function is the result of dynein arm dysfunction in Cartaginer syndrome. Flagella. Flagella are structurally similar to cilia, but their absence or dysfunction is not associated with the described clinical features. Let's move on to the next question. We have a 6-month-old male that presents with growth parameters at the 3rd percentile for both weight and height. He failed to pass meconium at birth. Which of the following molecular combinations best describes the defective channel inherent to this patient's disease? I'm going to give you guys a few more seconds. Alright, moving on now. If you don't have your answer ready, please feel free to pause the video. Moving on. The patient's presentation is indicative of cystic fibrosis, CF, and autosomal recessive disorder linked to chromosome 7. CFTR, the defective channel in cystic fibrosis, is a cyclic AMP-mediated ATP-gated chloride channel. The dysfunction of this channel leads to impaired chloride transport, resulting in thickened mucus secretions and clinical features such as growth failure and meconium ileus. Therefore, the correct answer is C, cyclic AMP and ATP. Let's go through and see why the other answer choices are incorrect. Sodium and potassium. This combination is not related to the defective channel in cystic fibrosis. Calcium and phosphate. The dysfunction in cystic fibrosis is not associated with calcium and phosphate channels. GTP and IP3, also known as inositol 4,5-phosphate. GTP and IP3 are not involved in the defective channel of cystic fibrosis. Chloride and sodium. While chloride is a component of the defective CFTR channel, sodium is not directly implicated in this molecular combination. The primary defect is in chloride transport mediated by cyclic AMP and ATP. Let's move on to the next question. We have a 24-year-old female that presents with an autosomal recessive condition, low serum vitamin D levels, and a history of 2 episodes of Pseudomonas pneumonia. What is most likely to occur on a cellular level in this patient's pancreatic ducts? Give you guys a few more seconds. All right, I think that's enough time. Let's go ahead and move on and see what the correct answer is. The patient's presentation is indicative of cystic fibrosis, an autosomal recessive disorder. The defective CFTR channel in cystic fibrosis leads to impaired chloride secretion into the pancreatic duct lumen. As a result, more chloride is retained within the cell, causing an imbalance that leads to upregulation of ENaC, epithelial sodium channel. This in turn causes increased sodium movement from the lumen into the cell, followed by water, resulting in inspissated secretions within the pancreatic duct lumen. This process contributes to exocrine pancreas malsecretion, impaired absorption of fat-soluble vitamins and macronutrients, ultimately leading to failure to thrive. Therefore, the correct answer is B, upregulation of CFTR. Let's go ahead and look at why the other answer choices are incorrect. So we have downregulation of ENaC. In cystic fibrosis, ENaC is upregulated due to the defective CFTR channel, not downregulated. Inhibition of sodium channels. The defect in cystic fibrosis results in increased sodium movement into the cell, not inhibition. Increased chloride secretion. The defective CFTR channel leads to decreased chloride secretion, not an increase. Inhibition of water movement. In cystic fibrosis, the imbalance in chloride and sodium leads to increased water movement into the cell, causing inspissation of secretions. So, yeah, that's all the questions we're going to be doing today. I felt like these were relatively good questions to expand upon for the molecular and cell biology video. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, this is FixerMed signing off. Study hard, and goodbye, everyone.